Success. Never know which screen it's going to show. Okay, so I think I'm going to zoom through some of the stuff because I think the actual practical pieces are probably what people are more interested in. So I'm going to kind of go a little bit quickly through some of the background stuff, I think, and focus more on the practical stuff just based on this discussion, which was so helpful to start with. So, the learning objectives, again, I'm going to spend very little time, but we will touch base about the epidemiology. I think you all are already very well familiar with this. I'm going to talk about one framework that you can consider to use for screening and brief intervention. This works for e-cigarette vaping use, but can also be used for other substances as well. And then specifically talk about some strategies for treatment options for adolescents who want to quit or cut down on e-cigarette use that can be implemented in schools. So just so we're on the same page, when we talk about vaping, we're talking about the use of electronic cigarettes or e-cigarettes. These are battery-powered devices. They heat a solution of liquid nicotine, also can be CBD. We were talking in the little breakout group that I was in about also kind of how that's becoming more of a problem. There's often flavorings and other chemicals. This creates an aerosol. The use of the e-cigarettes, often called vaping. And what is so problematic right now is that many of these are being marketed towards children. Specifically, you can see kind of in the middle here, these disposable versions, which have some of them even video games actually incorporated into them. So they get like the double dopamine reward system kind of hit to them. So the marketing companies are really very much targeting adolescent users. In terms of trends, there was a huge increase in the late 2010s where it was like 1 in 4, 1 in 5 high school students, 1 in 4 high school students, 1 in 5 students between middle and high school were using. That did go down significantly. There's a gap in the data here because of COVID. Now we're at about 8% total of high school students that are using e-cigarettes on the most recent data. What is, I think, concerning amongst those users is that those who are using very frequently. So you can see kind of on this upper right-hand slide of those who are current users, so past 30-day vape users of e-cigarettes, 26% use them daily and 38, so almost 40% use on 20 out of the last 30 days. So they're using them very frequently. These are not casual users for the most part. Um, but the good news is that many of them, 2/3, want to quit and have tried to quit. So I think in terms of kind of the messaging getting out there, it is getting out there that there are health concerns about vaping, and students, these teens want to quit, and so some of this is just linking resources, I think. Um, we did talk about this in terms of the messaging around this. It's not just harmless water vapor. The aerosols can contain these toxic particles, heavy metals, particularly the flavorants are quite concerning. There was the popcorn lung disease back in 2019 that made a lot of news, which was one of the flavorants. Also concerning, I think, is that e-cigarette use is we're seeing it's likely undermining social norms about tobacco in general, so that we are seeing a rise in combustible cigarette use. So young people who had ever used e-cigarettes had a 7 times higher odds of ever using combustible cigarettes and an 8 times higher odds of currently using cigarettes. So there are both dangers of using the e-cigarettes themselves, but then also dangers that they are co-using them with combustible cigarettes. Nicotine, primarily this is going to be about nicotine used in the e-cigarettes, not CBD, but of course a lot of these things have parallels. Um, One of the concerns is that the actual nicotine content in the e-cigarettes has skyrocketed, so tripled in nicotine strength and quintupled in capacity. So just the volume of actual nicotine that the teens are getting exposed to in the vapes has skyrocketed. And this is a concern because of the risk of nicotine on the developing brain. So this is part of that developmental stage. We know that nicotine can lower impulse control and can lead to mood disorders. It can disrupt attention and learning among youth and young adults. And one of the most concerning things that actually we think primes the dopamine circuitry, that reward circuitry in the brain, and increases the risk for future addiction to other substances. Why do adolescents vape? Good old-fashioned peer pressure, friends using them, curiosity. But then amongst youth who continue to vape, the most common reasons are about mental health issues, so anxious, stressed, or depressed. And then because of the actual kind of euphoria, the higher the buzz from the nicotine. And again, why is it so important to intervene in teens? Because of the progression of use. So almost all adults addicted to nicotine started smoking or using when they were in their teens, and then nearly 9 out of 10 adult smokers started by age 18, and 99% started by 26. So getting prevention and cessation efforts in this teen age group is so important. I'm going to share with you this is some of the results of the focus groups that we've done as part of our project. Because I think it actually goes along with a lot of what you all were saying, and particularly in the breakout groups and then once everyone was sharing. But one of the things I thought was so interesting is that for the most part, I think everyone's actually on the same page about what they want, what they need, and what would be useful in terms of addressing this. It's really just a matter of kind of figuring out how to get there. The teens really were asking for kind of supportive, non-judgmental environments. The parents were very clear that they want programs that address the underlying addiction and not punishment. Um, the teens were not super thrilled about a group format. They really wanted one-on-one or really small groups because they were nervous about sharing in front of other people. The parents really wanted consistent responses. Um, and then, interestingly, the teens did not want parent, not interestingly, really, probably unsurprisingly, the teens did not really want parent involvement. And in fact, many of them commented that part of the reason they're not so concerned about the risk is because many of the adults in their lives vape. And so this is an ongoing concern that we hear is that, well, if it's so bad, why do my parents, why do my teachers, why do, the coaches? So I think this is one of the big areas for intervention actually is if we care so much about teens not vaping, we really actually have to do a better job of adults not vaping also. Like those things are very related. So that was a very fast zoom through the epidemiology, and now I'm gonna like just focus a little bit more on some of the practical stuff. This is a model that ACT model, so Ask, Counsel, Treat. It's a framework that was developed by the American Academy of Pediatrics and the CDC to help pediatric clinicians address e-cigarette use, but it's not really new. It's based on this SBIRT framework, which is screening, brief intervention, or referral to treatment, which many of you may have heard of, which is an approach that's been developed and advocated by SAMHSA, the Substance Abuse and Mental Health Services Administration, and has pretty robust evidence to support its efficacy in terms of you do not have to have um, you know, like 4 hour long sessions. Like sometimes really brief interventions, referral to treatment can be a model that really does work. So in terms of screening, there are validated screening tools. One thing that I think is important to remember when we're talking about e-cigarette use is that you have to explicitly ask about vaping rather than talk about e-cigarette or tobacco use because the teens don't always perceive them as equivalent. So you have to specifically say like, are you vaping? And are you vaping like nicotine or CBD? And then this validated screening tools that are recommended, there's BSTAD, the brief screener for alcohol, tobacco, and other drugs, and then the CRAFT, which I think is the more commonly used tool. However, you have to use the 2.1 version of it because the actual original version of CRAFT does not include nicotine, which is also, I think, just goes to show how little people were sort of wondering and worrying about this back when that tool was originally developed. Um, the other thing that's important to point out about this is adolescents are much more likely to be honest if you self-administer the questionnaire as opposed to like directly asking them the questions, which again, I think is probably what you would guess if you had been asked which way they would be more honest. When you are screening and talking to teens about this, one of the things that makes it a little bit challenging is that it's actually pretty difficult to standardize the amount of e-cigarette usage. So for cigarettes, it's super easy, right? Like how many cigarettes do you go through? How many packs a day? How many packs a week? There is not one public health unified agreed upon measurement for e-cigarette use. And part of the problem is, again, there's like all these different products, there's all these different percentages of nicotine in the liquid. Um, there's all kinds of different volumes of liquid in the products. And so there's not a great standardized way of measuring this. I tell you this not because you are expected to measure it perfectly, but just because when you're asking these questions around how much use, there's some tricks to it, but that it's not a perfect system. So after you've screened, if you have a kid that is using, there's these tools for brief intervention. And most mental health professionals can do basic cessation counseling. There is accredited programs for tobacco treatment training. And when the slides go, I'm realizing that that's probably not going to be an active link when the slides go out. But if you just Google tobacco treatment training programs, you can get there. It is something that I'm aware that some school, like drug and alcohol counselors, are taking just to be able to do more specific tobacco treatment counseling for teens. But for the most part, what you're going to do is align with the developmental stage of adolescence, where they're trying to develop their own autonomy. They're trying to figure out what their goals and values are. And you're going to try to link your counseling with that developmental stage, as you are already doing, I'm sure. The treatment plans, will be presented in a clear and personalized manner, but the important thing here is really a strength-based approach. Again, so like historically, we were approaching this very punitively, and the way that we're moving with this is towards a strength-based approach, helping empower the adolescents to make their own healthy choices. Just some strategies, getting permission, so not just lecturing, of course. Would you like to talk about your vaping? Are you interested in quitting? What do you know about resources? And what do you know about any medications to help with quitting? And then I think this is really, really critical with teenagers is honoring their autonomy. So this is completely up to you. Can I give you some information? Would you like to talk about this? So that's a tricky needle to thread, I think, when they're like there for punishment or if they've gotten in trouble at school. But I think as best you can, trying to thread that needle. And then when talking to kids in school, one of the things is like that the kids were really worried about when we talked to them about this is outlining the terms of the confidentiality. They were very worried about, in fact, they were very worried about mandated reporters talking to people about their vaping and e-cigarette use. So outlining the terms of confidentiality and including the reasons when it might be conditional. In New York, substance use disorder treatment is considered a topic that teens can receive treatment for confidentiality. Confidentially, it is substance use disorder is one of the carve-out things like teens can get do not need parental permission for treatment, and nicotine use disorder falls within that. So from a treatment perspective, they are able to get that without parental permission. Of course, it's always better if the family, not always, but in most cases, it is better when parents and families and caregivers are involved. I do want to point out that in most cases, there's a dose-dependent relationship between the number and intensity of counseling sessions, and cessation rates. So for school settings, like brief, short interval follow-up sessions are a great way to kind of implement this so that you see a kid frequently, but it does not have to be long. It can be short sessions with short interval follow-up. And then finding the motivation. This is like the real, I think, key to all of this is what do they want? What are they hoping for? What are their values? Many adolescents will cite long-term health consequences, sports and school performance, but then there'll be some disconnect, right? Like they'll say that, but then their behavior doesn't always go quite along with that. And again, it's part of that like adolescent stage where they're sort of like ambivalent about a lot of the health consequences or don't really believe in like they know in theory that that's a possibility but don't really truly believe it will happen to them. So I think a lot of the counseling is around that, like getting through that ambivalence and seeing if they you can really help them understand that the consequences are real for them and how does the use of e-cigarettes either align or not align with the values and goals that they have for their life. And then basic kind of barriers to quitting, etc. One of the things that always struck me is that some of the kids were talking about how common it is for the bathrooms to be just filled with kind of the vape aerosols, and that if you even if you were trying to quit, that the exposure is just constant in the schools. And so imagine how difficult that is if you actually are finally getting around to the point where you're like, okay, I'm ready to quit, I want to quit, and then you're like trying to go to the bathroom and you're just constantly exposed to it. So I do think like exploring barriers around that, thinking about how that what that looks like for teens is really important also. And then these are just kind of tricks and tips for motivational interviewing. I love this 0 to 10 scale. You're probably familiar with it. Basically, you just ask on a scale of 0 to 10, and then like I usually ask importance, readiness, and self-efficacy. And essentially, as long as you get anything that's not a 0, you can work with that. Like if they're a 1, you just ask like, okay, what's getting you to a 1? Like what is that little nugget of importance or what is that little nugget of self-efficacy? And you can kind of really, I think of it as it's like this little like pearl and you're trying to like grow the pearl. If you can get them at a 1, you can always get them higher than that. If they're at a 0, that's a really big challenge. You have to work a lot harder. But if they're at a 1 or anything higher, you can grow that. And then just briefly, I'm going to talk about kind of the evidence-based treatment models. So what works, in general, the evidence around how to prevent and limit youth vaping is quite limited, and there is just a need for more research around this. It's only really recently that there's been public health attention paid to this, I would say. In general, it's likely that for patients that have moderate to severe dependency, the best outcomes are likely from a combination of behavioral and pharmacotherapy, so medications and counseling. This is the literal only randomized controlled trial that's ever been published about vaping cessation in teenagers. It was published last year. It's from the This Is Quitting program, which is from the Truth Initiative. It's a texting program. So this is the results from that texting program. That what's most interesting, I think, about this is that actually the assessment only control had pretty high rates of quitting also, which I think just goes back to the fact that like any kind of intervention where teens are feeling like they matter and that they're being noticed and kind of I think paid attention to will help them, and that it does not have to be like some kind of perfectly messaged intervention. But this is a free program. This is the actual program itself. Any teen can use it. They just have text ditch vape to this phone number and it's free. There is actually a New York State one too, which I will share. Um, oh God, 1 minute. Okay. Let me go through real quick. So this is
Tally, maybe 1 more minute and then we'll switch to Keith's
okay.
presentation and we'll share
Yeah.
all of these with
Okay.
everybody so they've got it.
Perfect. I think I'm just going to talk briefly about NRT. So I just want to mention that nicotine replacement therapy is recommended for youth who are moderately to severely dependent, and this is just not something that is necessarily widely available. A lot of pediatricians and family doctors are not used to or routinely comfortable with prescribing nicotine replacement therapy. Um, Essentially, these are the characteristics of what define moderate to severe use. You can also use this scale. As I mentioned, it's a little bit hard to do the measuring, especially of this, how many times a day do you vape, because that can mean a lot of different things. What I think is most interesting is like how soon after you wake up do you vape, and then also do you have trouble refraining? And then the last thing I want to say is the recommendations that we kind of came up with after our focus group. So the most important thing I think the top line is to build confidential, non-punitive help-seeking systems. And I think Melissa, the person who that shared about the redoing their code of conduct, this is the thing that if I can leave you with one thing is that this is what the kids are asking for is this non-punitive help seeking system that includes a referral to a treatment program if possible. And then to create vape-free zones so that if students are trying to quit, that there are places that they can go where they know that they can go to the bathroom and they won't be surrounded by that aerosol. And then emphasizing belonging. The kids were really strong about like wanting it to be like the emotional messaging needed to be stronger than the fact-based messaging. And then the adults have to model the behavior. And then that actually parents wanted evidence and facts, but students seem to respond more to emotion and stories. Okay. Sorry,
Thank
that was like a lot to cover.
thank you so much, Holly. You